My name is Richard Gunderman. I'm delighted to be with you. I had the honor of being present when the idea for firm was hatched. That took place in a room some of you may know, the Riley Outpatient Center Conference Room C. And there have been at least 3 people here today who were present in that room at that time. One is Chris Sinzabaugh, who's in the back row, did a terrific session on attention, right, Chris? Do I get that right? I'm not ex-military, so I don't know. Another, I was one, Ethan Moracle, who was here. He's doing a fellowship in obstetrics, having completed a family practice residency. He actually came all the way from Minnesota to be with us today, but isn't here now because his flight is leaving soon. And the 4th person isn't with us in body, but I would like to think he's with us in spirit. There are at least 2 people at this conference who have on their wrists, I'm one of these people, a green wristband, which has the name of a person, which I won't utter, but on the outside surface of it, it says, "Tell me everything, how can I help?" And that was a signature phrase of a former medical student at the IU School of Medicine who's no longer with us, but whose imagination and enthusiasm played a big role in the creation of firm. And although he's not here, in fact can't be here with us today because he's no longer living, I know it would give him great pleasure. He'd be beaming with pride if he had a chance to see all the people who've been here today and the terrific presentations and conversations we've had. So I want to talk about the good news about burnout, kind of a countercultural perspective, but I really think there are some redeeming features to burnout that we dare not lose sight of. By now, this information seems old hat, but I just want to point out that burnout can have, on the right side of that image, disastrous consequences. People approaching work every day with an undue sense of anxiety, people suffering from depression. By the way, current thinking suggests that burnout, as we conventionally defined it, may be very difficult to distinguish from depression. And that in fact, often when we use the word burnout, what we're in fact referring to is depression. I've personally known physicians who battled substance abuse, addictions of various kinds, and unfortunately at the IU School of Medicine, we've lost 2 students over the last several years to taking their own lives. So this is no joke. That's the extreme end of a spectrum that somebody would feel like the best approach to the problems or challenges they face in life is to end their life. But we have to recognize that the questions we're posing can reach that level of difficulty for people. This is a portrait painted by Vincent van Gogh, actually one of 2, entitled Dr. Gachet. And Dr. Gachet actually cared for Vincent van Gogh late in his life. And I think there's definitely some bad news about burnout, which other speakers have addressed more eloquently than I can, but I at least want to touch on it in passing. People talk about the costs of burnout. Number 1, burned out physicians are more likely to leave their position. In some cases, to leave the practice of medicine, but at least to leave the practice or institution with which they're practicing. That can be expensive. Burned out physicians are less productive. We get less work done than people who aren't burned out. The quality of care we provide is, in objective terms, not as high. Our patients tend to be less satisfied. Just imagine an enthusiastic physician versus a burned out physician caring for you. And finally, patient safety actually appears to suffer when physicians are burned out. That's bad news. But there's also some really bad news. This is perhaps the country's foremost physician expert on burnout, a man who will be visiting the IU School of Medicine next month. His name's Tate Shanafelt. He's the first physician to be hired by an academic medical center as a full-time physician wellness expert. And I think the really bad news about burnout is more or less the same thing. We're starting to talk more and more about burnout in terms of its adverse effect on productivity, turnover, quality, safety. To me, that's letting the tail wag the dog, maybe putting the cart before the horse. And in fact, last year, Tate Shanafelt and colleagues authored a paper called The Business Case for Investing in Physician Well-Being. It's nice that there's a business case to be made, but if we are so far gone that we think the reason to invest in the well-being of our colleagues and our students is because it's going to cost us money, then our situation may be truly hopeless. There are other reasons to be concerned about physician burnout, and I want to say I don't think all the news about burnout is bad. This is a very famous individual in the history of English letters. And this is, in fact, that individual's, well, I'll put it this way. This is either that individual's death mask or life mask. Can you tell which it is? Is this a mask of the individual that was cast while he was still living, or one that was cast post-mortem? But this great figure in English letters said, "Until we are sick, we understand not." I'm not quite sure what he meant by that, but at least with respect to physician burnout, health professional burnout, I would say this: unless we have suffered in the practice of medicine, in caring for our patients and caring for each other, it's going to be difficult for us to understand the nature of the work in which we're really engaged. That sounds like some kind of goofy Zen koan, but that was, in fact, those are the words of John Keats, one of the best-known English language poets, a man who led a remarkable life. I want to tell you just a little bit about John Keats. This will come and go so fast that if you blink, you'll miss it. Keats was born in 1795. What could somebody born in 1795 possibly have to say in the way of enlightening perspective about what it's like to practice medicine in the 21st century? Well, I'm going to suggest the answer may be a lot. He led a difficult life. His father was a stabler, somebody who cared for horses in stables, and his father was killed in a horse riding accident when John Keats was 8 years old. By the time Keats got to be 14, his mother died of what physicians then called consumption. We know it probably as tuberculosis. There's good reason for us to take pride in John Keats, because when he was 20 years old, he joined our profession. John Keats is without a doubt the greatest physician ever to write in the English language, at least greatest physician in terms of the quality of his poetry. He started practicing medicine at Guy's Hospital when he was 20 years old, and shortly thereafter, John Keats got sick, got the dwindles, and coughed up some blood, and realized that he himself was suffering from tuberculosis. Unfortunately, the treatment in his day involved things like starving him, feeding him small quantities of only a few foodstuffs, and bleeding him. And it's quite possible that our profession hastened the death of the greatest physician poet ever to write in the English language. John Keats, in fact, died when he was 25 years old. Younger than some of us in this room. How did he manage to accomplish so much? Well, I think part of the answer is one we'll see in a minute. Keats said, I know the color of that blood. It is arterial blood. I cannot be deceived in that color. That drop of blood is my death warrant. I must die. That's a terrible realization, but some very thoughtful people over the course of human history, human arts and letters, philosophy and theology, have thought that it's in fact in recognition, awareness, consciousness of our own death, which for you hopefully is well more than a century in the future, but nonetheless it's the awareness of our own mortality that unlocks our capacity to make the most of each single day. If I know my days are numbered, if you can teach me to number my days, you will make it possible for me to live for today. Or to put it differently, to live fully today. To seize the day, right? Carpe diem, seize the day. Until we come to grips, until we're conscious of our own mortality, it's hard to make each day count. So, on the one hand, this is a terrible burden, but on the other hand, it can be terribly liberating. This is Keats writing to a woman for whom he cared deeply, named Fanny Braun. I've left no immortal work behind me, nothing to make my friends proud of my memory, but I have loved the principle of beauty in all things. Now that image up there, you see some illegible stanzas of poetry. Those are actually words Keats penned and that are now found on a street in the city of Leiden. If you've ever been to the Netherlands, this is above a bookstore, these words of John Keats. Those words are up there on a wall in an out-of-the-way place in the city of Leiden. So in fact, Keats's words live on, and it's hard for each of us to know how our words might live on and whom they might influence someday. I'm tempted to read that Keats poem, but I'm not going to. So John Keats dies when he's 25 years old. Essentially, everything he writes is written in the short space of 3 years. And his complete poetic output is 54 poems. In a sense, perhaps he didn't produce much, but anybody remember that guy? He's blind. He's from the Americas, but not North America. That's an important 20th century, primarily short story writer, Jorge Luis Borges. Borges said, "It was my encounter with the poetry of John Keats that constituted the most significant literary experience of my life. A man working against the clock, knowing that his days are numbered, but trying to produce something worth remembering, something that someone else might read years, decades, centuries in the future, and find illuminating, perhaps even transformative." By the way, I would suggest you'd have that experience if you read some of the poetry of John Keats. His entire body of work is immediately accessible to you right now at absolutely no cost, right? The copyrights expired a very, very long time ago. So what's the good news about burnout? I think that's it. You've seen these words once. John Keats said, "I have loved the principle of beauty in all things." Have you loved the principle of beauty in patient things, in doctor things, in medical things? Is there beauty in our daily work, readily apparent or perhaps deeply concealed? Or is beauty an idea that has absolutely no truck with what we might call the practice of medicine? I want to suggest that that latter possibility is false. If you think what you see in medicine I had a chance to see my father-in-law's right leg recently. It's quite off-putting. He has some very, very deep wounds in his right calf. I think most people would grimace, perhaps turn away in disgust if they saw it. I mean, you might say there's a lot in medicine. There are sights. There are sounds. I'm occasionally subject to the wailing of infants and small children. There are sights that we might find off-putting. You might say, gosh, we deal with disease, suffering, death. Our mission is to ignore what's ugly, perhaps even to lament what's ugly, but basically try to keep it at arm's distance, distract ourselves from it so that it doesn't trouble our internal mental and emotional equanimity. But here's another possibility. What if we are in fact in the midst of beauty or the beautiful far more than we commonly suppose? And if only our eyes were opened, if only we could see as we're meant to see, we would find much in the work we do every day, not only deserving of our recognition, but even deserving of our celebration. Anybody recognize that guy? That's by Rembrandt. That's a portrait of somebody known as Augustine of Hippo. And Augustine of Hippo wrote this line, "Late have I loved thee, O beauty, ever ancient, ever new. Late have I loved thee." The idea is that there's something beautiful in our work and in our lives that somehow we learn to ignore, perhaps that we're blinded to, and that one of our principal missions, not only as physicians or health professionals, but as human beings, is to try to open our eyes anew. We're right? We're people with our eyes closed. What would it take to open our eyes to that possibility of beauty? Well, here's a chance. Here's the sober assessment, the bad news about burnout. The culture you are joining, the culture of healthcare in the 21st century, has had most of the beauty sucked out of it. And it'll do the same to your patients and eventually to you, so that you're grinding out work in an environment that you could call uglified. That's one possibility. I think that's dead wrong. Another possibility would be that you and I labor, if not every day, at least frequently, in a place where beauty is there to be seen, if only we have eyes to see it. And the proposition I would make to you, to understand organic chemistry, to understand thermodynamics, to understand molecular biology, you and I would expect that we would need to devote at least weeks, perhaps even months or years of intense study to grasp those subjects, even longer to master them. What if, in fact, to open our eyes to the beauty that's there waiting to be recognized and celebrated would require an effort of a similar degree? And unless you're willing to invest weeks, perhaps even months or years, to the intense effort to open your eyes to that beauty, the prospects for doing so are dim. That, by the way, is John Keats as he lay dying. John Keats on his deathbed, some of you may know, but he's thought to be buried in Rome, not too far from the Colosseum in Rome. So I want to tell you one story. It's a true story. It's about a visitor to a nurse's station in a hospital. True story. A visitor to a nurse's station in a hospital. It's an old man. This, by the way, is Rembrandt's depiction of an old man. This old man was gaunt, out of place. He was so out of it that he'd been placed in a posy. Anybody? What's a posy? Originally, it was a proprietary term like Kleenex. Now, like Kleenex is a synonym for facial tissue. What's a posy? Yeah, basically a restraint where you could wrap it around me, my torso, around the back of my wheelchair, and it would keep me upright. Because if you don't keep me upright, I'm going to loll to one side, or I may slump forward, face plant in my tray of food, right? So for humanitarian reasons, good medical care, you've put me in a posy, so that's not going to happen. And this old guy has been placed in the nursing station. Why? Basically because a large team of healthcare professionals was coming down the hallway. He was seated outside of his room. Somebody saw that a collision, or at least an obstruction, was imminent, and they wheeled him over into the nurses' station. There he sits, totally ignored by everybody in the nursing station. He's like a piece of broken furniture. Nobody even sees him. He's there, but it's as though he's not there. He's of no interest to anyone. So that kind of sets up what's to come. So this old man in the nursing station, with absolutely no warning, no prompting, no interaction of any kind, at a particular moment, the timing which is a complete mystery, breaks out into song. And to everybody's astonishment, he has a beautiful tenor voice. And he is singing forth in a voice which is clear. Clear as a bell. This doesn't sound like somebody with dementia. This doesn't sound like somebody who's mentally or physically incapacitated. This sounds like the soloist, you know, at a local religious service or something. And he's actually singing with perfect pitch. This old man, who looks like nothing, turns out to have a beautiful singing voice. And he sings front to back without interruption, a hymn that some of you may know happens to have been composed in the 20th century. I won't tell you the words or try to reproduce the melody, but the title of it is, God Will Take Care of You. This is weird. I don't know how much clinical experience you have, but this is a weird event. This is bizarre. This is impossible to count for. To call it a mystery accords it too much respect. It's just a peculiar thing that's unfolding in real time, very close to where you're seated, and nobody knows what to make of it. You know? Should we get some medication, you know, to get this guy to stop? You know, this is odd. This is a hospital. This isn't supposed to happen around here. How can we make this disturbing thing go away? And as this old man starts to sing, first you can hear some snickers. You know, people smiling, laughing, shaking their head. You know, these crazy, demented old people. You know, what kind of stunt will they try to pull next? Who knows? But it doesn't take very long before not only the nurses' station, but the entire unit, including all the patients on it, is silent. This is weird in a hospital, but you could hear a pin drop. Everybody's silent, and this silence actually persists for several minutes, and when he stops, you look around the nurses' station in the unit, and you notice that most of the people upon whom your gaze falls are wiping away tears. That's not supposed to happen. Is there an ICD-10 code for that? Is there a CPT, current procedural terminology? Is there a CPT code? How do you even describe this event? We don't have the vocabulary to do it. It's like an event that doesn't even count. It's not even real in terms of the lexicon, the grammar and syntax of a hospital, of an inpatient oncology service, but it just happened. A bunch of very busy people with long to-do lists, many of the boxes on those lines still unchecked, to a person, completely stopped what they were doing, sat in a kind of stunned and perhaps shortly thereafter reverent silence, and to their surprise noticed when this old man was done that they were weeping. What just happened, and what does it mean? Well, I don't pretend to know for sure, but I want to tell you one thing about it. Nobody ever saw this old man again. His stay in the hospital was short. Maybe he was discharged to a nursing facility. I don't know, but he was gone. Nobody's ever seen this man again. We don't know what happened to him. But the memory of this event lingers in the minds of all the people who were there when that song unfolded. You know, in space or time. It was like a different kind of space or time. And I would like to suggest to you that, for lack of a better word, that was an encounter with something we might call sublime, or I might prefer to use the word beautiful. Something beautiful just happened in our midst. How do we talk about that? What does it mean to us? I think that actually might be a key in thinking about this problem of burnout. These are lines of John Keats again. Majestic shadow, tell me, sure not all those melodies sung into the world's ear are useless. Well, was it useless? What purpose did it serve? Perhaps our eagerness to find a purpose is precisely what blinds us to the beauty of the thing. Our insistence that everything must serve some purpose beyond itself. Our quest for efficiency and effectiveness and safety is what blinds us to the very possibility of the beautiful. Sure, not all those melodies sung into the world's ear are useless. Sure, a poet is a sage. That old man, could he have been a poet? Poet comes from the Greek meaning to make. He made something beautiful. He didn't write the melody or the lyrics, but in the singing of it, he brought it into being in a way that affected deeply everybody who heard it. Sure, a poet is a sage, a humanist, physician to all men. We all know we need more science. Bench science, basic biomedical science, clinical science, decision science. What if I said we also need more poetry in medicine? What if I said if we mean to really understand and do something about this burnout problem, we need to understand something about poetry, which in turn means understanding something about beauty, a subject rarely, if ever, referred to, a word almost never uttered in contemporary healthcare, but which might constitute one of the most important resources we have at our disposal if we ever knew it. So what was this old man? By the way, unnamed. We don't know his name. Old man. What was he? Possibility number one, a piece of broken furniture, a nuisance, a drain into which our time and energy is being poured with no hope of a useful or a productive outcome. Possibility number two, that anonymous old guy was and remains a prophet. He was a prophet. What do I mean by that? That he reminds us, if we want to develop our ability to recognize and celebrate beauty, we're going to have to invest not just a day or even our whole careers, but in fact a lifetime. You could do more for the profession of medicine, your colleagues and yourself, by awakening us to the beauty that's around us and within us than doing almost anything else. Who knows that? Who talks about that? Who evinces that kind of awareness? And the point might be not only that we're going to witness this beauty, but that to some degree we have the possibility of being co-creators of that beauty. Could you make something beautiful happen in the nurse's station, at the bedside, in the classroom, in the laboratory? Is that even possible for us? Or are we people who've resigned ourselves to a kind of ugly existence in which beauty isn't even a possibility for us? If the latter is the case, I don't think we should be surprised that we find ourselves in the midst of an epidemic of burnout. What's the good news about burnout? It reminds us that we've lost sight of the beautiful. Burnout reminds us that we've ceased to recognize the beautiful. Something that simply is for itself, not for the sake of anything else. It's not a means to produce anything else. It simply is in itself. That's a weird thing to say, but I think it's an accurate description of beauty. And because we are so focused on useful things, efficiency, effectiveness, safety, all good things, that sometimes we lose sight of the beautiful. So, if you want to do something about burnout, prepare for a long trek. One that's going to last not just for a few years of medical school or residency, not even a few decades of a career, but a lifetime. But if that's what we aspire to, if that's what we hope for, we might be able to utter with conviction this line penned a long time ago by John Keats. I have loved the principle of beauty in all things. To fail to see what's beautiful in our patients, what's beautiful in each other, what's beautiful about the practice of medicine, having in some cases complete strangers entrust us with their health, or the health of the most precious people in the world to them, is a kind of beautiful thing. And only if we're awake to that beauty do we have the potential not to burn out, not to consume our fuel, not to destroy ourselves, but in fact to tap into a fuel source that I think is basically inexhaustible. The world as it's given to us contains inexhaustible beauty. And if we don't see that, the fault lies not in the world, but in ourselves. And to awaken ourselves and open our eyes to that, we have to commit to, I think, a lifetime of exploration, a kind of journey of discovery. And I think the farther we move along that journey, we'll be less likely to burn out, but we'll also be enduring sources of warmth and illumination for our patients, families, and colleagues. And that strikes me as something not only worth working for, but living for. So I think I'll stop there. The hour is super late, so I'll just sit down, okay? I'll take Peter's seat.